I could never do very heavy work because my hands are particularly fragile. I always tried to keep good care of them since certain related pathologies often are hereditary.
My mother suffered from arthritis and arthrosis. Therefore, I always suspected I would eventually develop problems, which I did.
So I went through the usual battery of ultrasounds and laser treatments. I used anti-inflammatory drugs and painkillers.
I underwent surgery to both hands for carpal tunnel syndrome, also for a clicking ring finger. Local injections of cortisone helped me to regain partial usage of my right thumb.
In the meanwhile, I was diagnosed with synovial osteoarthritis and assigned several drug treatments, including alcoxia, etoricoxib, and plaquenil, hydroxychloroquine, in combination with other drugs and, again, painkillers.
This situation is chronic, but the therapy and the mindful behavior help not to get worse.
The effects of this condition are swollen fingers and the very painful stiffening of the small articulations.
Those who suffer from these symptoms know how difficult it becomes to do even the simplest action.
It becomes impossible to tighten a grip on something, or hold steadily an object, or walk normally. Sometimes the pain rises up through nerves and tendons, along the wrist, the arm, and up to the shoulder.
When, about a year after surgery to my right ring finger, the one on my left hand began to swell and stiffen up, I consulted a specialist. I went again through ultrasounds and the rest of them without any result. Cortisone always implies a risk of necrosis in the application area, so I was recommended another surgery. But I didn't want to go through a new operation, especially because in the previous one I had suffered damage to a nerve of my right hand. This, I was told, is considered a standard risk. In the meanwhile, my right hand middle finger had fallen in the same way.
I decided against the surgery, continuing therapy for the chronic state, seeing my left ring finger become practically useless, assuming a curvature that, all in all, could be judged elegant. For my writing, I used short sessions, breaking them regularly to rest my fingers. This year, Dario proposed me again to learn to play guitar, a thing that I have previously excluded for obvious reasons.
But this time, I decided to try. I began with the chord of A, one of the simplest positions. I almost couldn't press the strings with my left hand, when the right one could barely try to strum.
Still, I learned a few chords and practiced every day, with difficulty and feeling some pain, stopping when it hurt too much.
Then, I don't really recall the date, I remember telling Dario. Okay, thank you.
No problem.
I don't want to say this too loud, but I can bend my ring finger.
Show me. Oh, yes. That's great.
Yes.
Perfect for the guitar.
It's now 3 months since that happened, and 4 since I began playing. Now my ring finger works again as the others. I think it might depend on the angle the hand takes in order to exercise on the fretboard.
a position which is different from the one it takes on a computer keyboard or on a piano.
It must be that, as I cannot find any other explanation. In any case, this moving and exercising must have unlocked a stiffened nerve, which to me is a small miracle, of course.
Playing by picking the strings with my right hand fingers will be my next goal, since the usage of the pick still creates too much tension in my hand, making it stiffen.
Is there an equipment to exercise fingers? Probably. And I'm not saying that that option is to be avoided, but I believe that learning to play an instrument has multiple results. Practicing guitar, my hand became less rigid, my ring finger got unlocked.
My other fingers feel well too. And on top of that, now I can make music alone or with others. I can only play songs with the simple chords for now, but I want to try more challenging things in the future.
You could try too. Simple things at first. Open chords, then scales, or other exercises a bit more challenging.
And for the right hand, arpeggios.
And when the hands hurt too much, stop immediately and rest them. But then start again. Do a little bit every day. Try. You'll be surprised at the results. And much, much happier.